Hey guys, it's Dr. Michaela from Active Life Chiropractic. Today we're going to be going over some transitions of the child's pose during pregnancy. So a lot of times I see moms with low back pain, especially in this lower to sacral area of your back, because as baby is getting bigger, our center of gravity shifts and we start to compensate for that growing belly by extending through our low back and getting a deeper low back curve. That can cause some compression and some tightness in those low back muscles, and this is a really good way to stretch those out, as well as decrease that extension by going into flexion of the low back. Okay, so when we think about our traditional child's pose, we think of our legs together, putting our arms out in front of us, and relaxing back. Obviously, if we have belly in the way, we can't do that completely. So what we want to do is we can either keep our feet in the midline and open up our legs to have a space for belly, or if we want to add a little bit of a hip opener, open up pelvic floor, which I think is a really great way to prepare for labor, we can keep our ankles outside of our knees. From here, I want us to come in the tabletop position and then hinge our hips backwards and relax down. If you find that belly's touching floor or you can't go all the way back, you can use a pillow or some blocks, place hands on this, then relax backwards. This is going to be a really good one to get some opening up through your arms as well if you're tight in your shoulders. So that's what this looks like. And what I want you to do in this position is take really big, deep breaths. I always say breathe into your hip crease. So we're sending that belly breath downwards towards our lower abdominals and relaxing through here. You'll notice how my low back is curved downwards here. That's that opposite position as when we are extended through here. So we're stretching out those low back muscles. We're getting a really good deep stretch for that back. Next, we can transition if we have a little bit more low back pain on one side versus the other. We're gonna add a little curve to our child's pose. So again, we're gonna get into our tabletop position, sit back, and then what I want you to do is cross arms to the right, and you'll feel a deep stretch on the left side of your low back. If you need a little bit more of a stretch, you can cross the arm over and get a little bit deeper of a stretch, and you'll also get a little bit of a lat and shoulder stretch through here as well. Back to midline, we are gonna go to the right. So we can, like I said, either transition one arm, then the other, or we can go one arm, cross the other arm over the other side. This next one is going to be for those people that have bands at home. So we want to hook a band behind you. So a really good way to do this is to put it in the doorway on the opposite side of the door and then shut the door so it's nice and anchored. Then we're going to step into our band, and you'll feel that you're gonna have some backwards pull on your hips. So you can put this, I would put it below belly, so it's around your pubic area and around your hips. Then from here, we're gonna get into that child's pose position. And it's the same kind of position that we did before, but this is gonna add a little bit extra pull backwards, so it gives our low back some nice decompression. So you can hang out here and again, breathe through the hip crease. This should be a really good decompression for your low back. Okay guys, this next transition of our child's pose is gonna be if you have a partner at home, you can ask them to help you. This is gonna be really good for those people that have that deep low back pain that's all the way down towards their pant line. So let's say Charles is my pregnant patient here. I'm the partner. You are gonna go into a child's pose, however is comfortable for you. Partner, I want you to follow the line of his low back down towards the sacrum. The sacrum is most of the time located at the belt line, and you can feel it by moving your hand down, and you'll feel a slight bump at the bottom of the back. What I want you to do is place a flat hand on the sacrum and do a little outward and downward pressure. So we're trying to lengthen through the back, okay? Sometimes it's easier if you go skin on skin. You'll have a little bit more traction, and you just add light pressure. And I want you to tell your partner to give you feedback. How does that feel? Good. So again, you're gonna be adding pressure down and away from his head. All right, guys, so those are the different transitions we have for the child's pose throughout pregnancy. Please drop a comment or give our office a call today if you have any questions about those, and I hope that these exercises help.